my grandma needs care and I'm going to have to go spend 8 hours a day with her because she doesn't have anyone else. Some of these people are setting up non-medical emergency transport to the doctor's appointments and they're very unreliable, like a medical Uber essentially, but they put you on a bus with several other patients and sometimes they remember to pick you up, sometimes they don't.
Jeremy, thanks so much for coming on to the Explain Yourself podcast. Can you please explain yourself for us?
Absolutely. Thanks for having me. My name's Jeremy Roberts. I am currently the CEO of the Surgery Center at Doral. And I recently also took off on another startup venture. I'm also the owner, founder, and president of Arden Home Care. It is a non-medical home care agency in Palm Beach. And our territory kind of runs from Indian River County all the way down to Palm Beach County. My background is essentially all I've ever done is healthcare. I did deviate a little bit and built a $25 million a year company that sold. It's called Pointer Transport and Pointer Logistics. It was a freight brokerage and a trucking company. Outside of that, that was really the only 8 years of my life that I haven't in some way been involved and worked directly in healthcare.
Tell me a little bit about your freight company. I'm wondering if that's still an industry that more people are getting into, or if that was very much based on timing.
Yeah. So the home healthcare for me as an entrepreneur, I think doing a good market analysis is always crucial in deciding on how you want to enter the market. And for me, I've only been in Florida for 8 months. And so I was not privy to the scene around here when it comes to home healthcare companies. But I did ask around a little bit. And the consensus that I got was there was a need. And first and foremost, I'm like, okay, there's a need. I can go into the space, but I wanted to know how competitive it was. There was several when I pulled up on Google. And so I essentially looked at the quote unquote competition and assessed it from there. And I pulled the census down and saw how many baby boomers we have in Palm Beach County and how many elderly people. Right. So I've done my homework before I just entered the market. And next, I weighed my startup cost. And so I felt really confident with the background that I have. My bachelor's is in business management, and I just finished my MBA from University of Tennessee in healthcare leadership. So I felt like that what's going to separate Arden Home Care from the competition. And we took the approach to hire the best caregivers. We pay $5 more an hour than our competition does. And I did that on purpose strategically. And that was to capture the best. And when people call Arden and says, hey, I want care for my mother who has memory issues. She has Alzheimer's, she has dementia, or my 93-year-old father he needs some help being transported back and forth to his doctor's appointments and medication reminders and ambulating to and from the bathroom. We can safely say that we are going to send the very best caregiver to your home. That was the MO behind Arden.
With home care, do you find that a lot of your clients are, say, needing special care for medication, but then they're asking for add-ons like nutritional IVs or some of these more like services that weren't as popular in the past? How common is that if you were to give a percentage?
I mean, for us, so we're on the home healthcare side, you actually have the skilled nursing. And then you have what's considered non-skilled nursing. So we are actually non-skilled nursing. We can help with we can't give medication because we don't employ RNs per se or LPNs. Someone with a true clinical background.
I thought that you had to, that say if a nurse comes to somebody's house, that they would have to actually work with you in some capacity or coordinate with you in some way. Maybe that's just my misunderstanding.
Yeah. So from a skilled perspective, yes, but that's typically done through a provider a payer. Medicaid, Medicare will send a nurse. If I got banged up in a car wreck today and had to have some sort of home health care through my insurance, they would take care of all of that for me. And they would send a true RN out to my house if I had to get meds pushed, right? What we do is more of a companion care, healthcare, home health service. So think about aging in place along those lines. Like, I don't want to go into an assisted living facility, or maybe I'm just starting to develop maybe some dementia or maybe a little bit of Parkinson's, and I don't quite remember daily to take my medicines. Those are where my caregiver team will come in and say, hey, listen, we'll come into your home with your loved one. We'll offer that companion care. if they're falling, if they're starting to have some fall episodes. We're a layer essentially that is mainly self-pay. But what it does is it takes out family members from having to constantly be involved in the care of their loved ones. They can still go to work every day, right? I think we've all seen those episodes with our family members where it's like, hey, my grandma needs care and I'm going to have to go spend 8 hours a day with her because she doesn't have anyone else. So that's where people will call us but you're right that we call them ADLs, your daily living routine, essentially. That does look different for each of our clients, but it's our services that we offer are medication reminders. Hey, here's your meds for the day. We do help ambulate back and forth. So your personal hygiene, toileting, bathing, we can take them to and from doctor's appointments. So that's a big help on the family. Some of these people are setting up non-medical emergency transport to the doctor's appointments and they're very unreliable. So,
Right.
and
Like
two,
the Uber.
yeah, like a medical Uber essentially, but they put you on a bus with several other patients and sometimes they remember to pick you up, sometimes they don't. And again, that stuff insurance will pay for. I guess the major knock on the non-medical home healthcare is majority of it is self-pay, especially in the state of Florida, because the Medicaid rate is so bad. Like it is so bad. It's $17 an hour. Minimum wage alone, like that doesn't leave you a lot of profit margin, right? We're talking business here. I can be that direct, like that from a business standpoint that we
Doesn't
can't
make
take medical because it doesn't make sense. Yeah. I'm paying a caregiver 22 an hour because again, we want the best.
Yeah, that does really matter. What do you think
Right.
about maybe, I don't know, 15 years ago? I remember going to this event with, say, these like healthcare representatives, diplomats. And it was in Copenhagen. It was when I was doing some work for the ambassador to Copenhagen. And so we had all these people who are trying to get into what's new, like what's going to be in medicine. This was before like AI came out or IBM
Yeah.
Watson, like that.
Yeah.
And I remember, I will never forget, this one company was starting to bring out these pills that you would swallow. And they were like little cameras. And it would tell you, oh, if your grandmother took their medication on time or not.
That's
And I remember
incredible.
this is a brave new world. This was like, I don't know, 2015 or something.
Yeah.
And kind of being a little scared because what if having home care where you have someone who actually really listens to you and knows you, it's not some sort of like penguin robot that some of these clinics are hiring for a companionship. They can give you personal care. What do you think about the potential of these really big companies thinking they can like replace, or do you see yourself actually using some of those things in the future?
So I'm definitely I think technology is great until it isn't.
Yeah,
As
I would agree
it
with that.
truly, I do think that we are in a very interesting time with the youth right now and how tech savvy they are. I think that there's going to be such a place for them in our society as just as you mentioned, we continue to evolve as a people and I think it definitely can help. You really hit the nail on the head there because you said something that I locked in on and all of that stuff is great, but it still removes the human side of healthcare. And at the end of the day, I think we all just want to be loved. We all want to be heard. Not many people that I know of truly just want to be alone, like forever and ever. And again, we have people who call us that just say, my mom just needs someone to talk to. Like,
Oh, really?
yeah, because
Yeah.
it's the companion side. Your kids unfortunately grow up and they move off and they leave. I saw a statistic the other day that said in the state of Florida, then the nearest relative, when it comes to companion care, the nearest relative lives 250 miles from their dad or their mom. And when you think about that, yeah, you can call people up today, you can FaceTime, but still, is it true human interaction? Is it true? Like I can look across, I'm sitting in my chair and you're sitting on the couch, right? Like that companion care, just having somebody there with you. I don't know that robots, and that's being in the acute, being on the other side of that in the hospital space, in the ambulatory surgery center space, you always hear of, oh, the robots are going to replace us. And I just don't know in healthcare that's going to be a true thing because at the end of the day, we're working on and we're dealing with people. And I feel like anytime people are involved, emotions are going to be involved and empathy is going to be involved. And I don't know that robots can be as empathetic as we can to one another as humans.
Yeah, my
So
understanding is that's not even in our lifetime to happen. And
yeah,
even
yeah,
what could that even mean? I can't
right.
imagine a robot to hang out with all the time.
Yeah.
I
That,
would sign up for home health care if I had and if I was doing that. I would think I
now,
need help.
now, with the pill thing would be really cool, right? Because even from a healthcare standpoint, like that's one less step that my caregiver would have to do. If it tells me Miss Jones took her
Yeah.
medication, fantastic, right? And then maybe even a step further, that tells her primary care physician, her PCP, that she's taking her medication. No doses were missed. When she goes back to her PCP, it keeps that electronic medical record somehow tied into that thing. Like all of that stuff is great. What happens if the system goes down? What happens if the system
Yeah.
crashes?
I
And
know, I have a lot of fear of that as well. Or what if it's just not working? They need to change the tier or something like that.
yeah, like I say, I definitely like technology. I do like to err on the light side with it, especially when it comes to human interaction. I think if we're building cars or if we're doing something manufacturing, technology all the way, robots, all what's going on at Amazon, right? I think that works in those moments where you can take the human side out of it and maybe it answers some of the staffing issues or efficiency issues.
Yeah.
Healthcare, I don't know,
Not so much.
not so much.
Yeah, that's what I'm reading as well. Healthcare is not really going to be replaced, especially nursing or
Yeah,
in where I guess you're right. People need that one-on-one. You how the aging in place is really interesting because more and more people are doing that now, right? Like
yes.
people are I spoke to someone the other day who works in like optimizing homes for healthcare. So essentially
Oh
they
yeah.
optimizing their house for someone like come in and staff a
Yep.
couple of like home healthcare people. But what he said was that a lot of people don't really know that they can do this. And they don't even know that insurance will help cover some of that. Is that the
That's
same thing
true.
with home healthcare? Say if I have a grandparent or somebody who's struggling, would the doctor even recommend that they
That's
find you?
So that is it. Very interesting you bring that up because in our marketing strategy, and again, me being from the acute care side, and for maybe listeners who don't know, acute care means like a hospital, somewhere where you go when you're hurt right now or you're sick right now. You go to the emergency
Yeah,
department,
like
you
surgery.
get to the ED, right? And so just to catch
Right.
everybody up, because I'm bad about throwing out terms that nobody else knows, but no, you're totally right. That's in our marketing strategy. One of our best partners right now is a plastic surgery center, much like the one that
That
I'm
makes
CEO
sense.
of in Doral. But what they're doing is we want to get our cards and our brochures in the hands of the nurses who are going to see so that you develop a relationship with your patient and hey, you just had a total knee done. Like
Yeah.
essentially you have one good leg to stand on. If the next words that come out of your mouth is I live by myself, I'm sorry. How are you going to get to your physical therapy appointments? How are you going to get to your follow-up? And how are you going to get around at home? Who's going to take care of you while you come out of the anesthesia the next 3 days?
That's
And
true.
but those have been so we just got 4 patient referrals yesterday from a plastic surgery center in Palm Beach County. I told my director, I'm like, get them 4 dozen donuts out there stat because we want to thank them for thinking about us. But those are the exact relationships because people don't have that knowledge. They don't quite know where to look for help for
Yeah.
their life or for themselves.
That's genius. The plastic surgery one is really genius because what if, yeah, they don't want to, what if the patients don't want to go out or they don't want, maybe they do have somebody, but they don't want anyone to know, they're embarrassed. I was just speaking to a friend, you just reminded me, who has a really bad injury. They have to get surgery for it. And he said, I need help like putting on sunscreen. So I just walked down the street to this massage parlor and I'm so embarrassed
Gosh.
because I'm asking them, can you help me?
Oh,
I'm paying them
geez.
to help me put on sunscreen and I need to hire someone. So what I need to do actually when we get off the call is I need to go tell him that he needs to give
Yeah,
you a
he needs to get
call.
yeah,
And
if he's in our territory, we'll definitely get him someone out to rub him down with some sunscreen.
what is your territory? Are you only at what's your territory now? And are you trying to expand elsewhere?
Oh, Great question. Yeah. So right now we are Palm Beach County, we are Okeechobee, Martin, Port St. Lucie, and Indian River.
Okay.
So yeah, based on the state, they have you select certain geographical areas. And I guess you start in one. They told me I could only select one to start out. And I don't know, as I think about scaling this, I think I'm going to do something completely crazy and be the crazy man that I am in business and scale this. I'm actually looking at Dallas, Texas next. Instead of scaling in Florida, I'm actually
Mhm.
looking at starting the second remote office in Dallas, Texas, and Charlotte, North Carolina's also got my eye. And it's just on the weekends and nights, I'm starting to pill around with some market analysis and seeing competition, and two, going back to Florida's Medicaid rate being so low. I'm also locking in on states where you don't need to be a licensed home care provider with the state at all. Out of the 50 states, there's 11 of them where you don't have to have a license at all as a business. You can literally just go create an LLC, hire
Awesome.
CNAs or caregivers and send them out. And for anyone listening in those states that wants to, has an entrepreneurial itch, this is a fantastic, like the baby boomer growth. It's a great business to get in, especially in states that doesn't have higher barriers to entry. But
Yeah.
Dallas, Texas, and Charlotte in particular, because Texas Medicaid rate is actually 32 or $33 an hour. There's certain states where, like Tennessee,
That's cool. I'm really happy you're able to merge both of those in business and healthcare. And I think it's cool that you're going in that you really leaned into the aging in place because that is probably what people are going to be doing now and in the future. Really nice to meet you.